For this to truly be a national vaccination effort, we must ensure equal access to the vaccine. National, state, tribal, local, and territorial practitioners and health workers from across the country working together can maximize access for all populations, especially those who are more likely to be exposed to or develop serious illnesses from COVID-19 and those who may face barriers to vaccination.
Me dolió un poquito, pero todo bien.
Have to be apart from one another is really hard.
It's all a part of Let's Do This, a campaign to educate and encourage.
There are more COVID-19 cases, hospitalizations, and deaths in areas where racial and ethnic minority groups live, learn, work, play, and worship. A comprehensive vaccine program provides equal access for all populations across the nation.
Good morning, everyone. I am Rear Admiral Felicia Collins, and I'm currently serving as the Acting Assistant Secretary for Health within the U.S. Department of Health and Human Services. It is my pleasure to join you today for the third and final day of the National Forum on COVID-19 Vaccine. It is my pleasure to be here with my colleagues from across the federal government and with each of you, new and longtime partners with the federal government from many sectors, but all working towards the same important goal of increasing vaccine access for all populations. I'm here today to add my voice to the conversation about maximizing equitable access to COVID-19 vaccinations. From a professional perspective, I've spent my entire career in the federal government as a physician focused on addressing health disparities experienced by racial and ethnic minorities and other underserved and vulnerable populations. I also bring a personal perspective to the conversation, as I've had a close family member hospitalized with COVID pneumonia, and I've lost multiple extended family members and close family friends due to COVID. Given both this personal and professional experience with COVID, I would be remiss if I didn't pause to mention that we all must still remain committed to those public health measures for a while longer in order to stay safe, especially in our hardest hit communities, which means wearing a mask, physically distancing, to include avoiding gatherings with those outside of our immediate household, and washing our hands frequently. Following the science of these public health measures and getting vaccinated when it is available is so very important because there are so many factors stacked up against our communities, increasing our risk for COVID infection, hospitalization, and even death. It is critical that we stop and identify for ourselves what are the true roots of our questions and concerns about COVID in general and vaccination in particular. And it is critical that we get our questions and concerns answered with accurate information so we can make an informed decision about obtaining the COVID-19 vaccine when it is offered to us. And once we have this accurate information, it is critical that we share this accurate information with others so we all can make an informed decision that protects the health of ourselves, our families, and our communities. And that is why you are tuned in today to the National Forum on COVID-19 Vaccine to get accurate information about the partnerships and innovative solutions being implemented to get vaccine into arms and to do so in a way that ensures equity. Today, you will hear about efforts from across multiple sectors, including federal, state, local, territorial, and tribal governments, healthcare providers, businesses, community-based organizations, and unions. The plenary will begin with national leaders showcasing the all hands on deck plan to operationalize the national response strategy to COVID-19. This promising practices panel will highlight innovative strategies, practical approaches, and strategic partnerships focused on increasing vaccine access to all populations, especially those at increased risk of COVID-19 disease and those who face systemic barriers to vaccination. I now have the pleasure to introduce to you 3 leaders from across the federal government who will be sharing more details on how U.S. agencies are working together to operationalize the national response strategy and ensure that vaccines get into people's arms as quickly as possible while ensuring equitable access. Dr. Marcellus Nunes-Smith is the Equity Coordinator of the COVID-19 Response Team and the Chair of the White House COVID-19 Health Equity Task Force. Dr. Nunes-Smith is a national leader in research focused on promoting health and healthcare equity for structurally marginalized populations. Ms. Jolinda Johnson currently serves as the Director of Equal Rights at the Federal Emergency Management Agency, or FEMA. Prior to joining FEMA, Ms. Johnson spent more than 18 years serving to promote civil rights and equal employment opportunity for federal employees. Dr. Nancy Messonnier serves as the Director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC, and is CDC's senior official on COVID-19 vaccine. All 3 speakers are committed to providing you with accurate information about COVID-19 in general and vaccines in particular, and so much more, so that each of us can share the power of information with our families and communities, and we can collectively defeat COVID-19. Now it is my pleasure to turn it over to Dr. Nunes-Smith.
Good day, everyone. It's terrific to be part of this session as we kick off day 3. I'm Dr. Marcella Nunes-Smith, Equity Coordinator on the COVID-19 Response Team and Chair of the U.S. COVID-19 Health Equity Task Force. It's my pleasure to join today and discuss a value that is shared across this administration, and that's centering on equity in our vaccination campaign. That's an imperative. Our country is at a very hopeful moment as we look ahead to increase vaccine supply and continue to make important steps to get this pandemic under control. Vaccination will be absolutely vital for us to overcome the pandemic. And it will only work if we can make the vaccines easily accessible to all communities. Right now, as states are preparing to further open eligibility, the focus is shifting from institutional settings, like long-term care facilities and hospitals, to the communities, to the neighborhoods where people live, work, play, and pray. This shift presents a new set of challenges for vaccine coordination and distribution, and also access. But the federal government is committed to a data-driven strategy to target vaccines to the communities that face the most substantial access barriers. This strategy includes a commitment to supporting vaccination centers as necessary to get the pandemic under control. The Biden-Harris administration launched 4 direct federal vaccine allocation programs in the first 3 weeks. The community health center partnerships, the retail pharmacy program, community vaccination centers, and mobile vaccination units. These programs are being executed to make sure we also reach the hardest hit and highest risk. And in this work, we're using metrics such as the CDC Social Vulnerability Index to target these resources. Plus, we're emphasizing the need to work closely with community and faith-based organizations to be most effective in connecting with their clients and their members. And we're working directly with state and local leadership on each of these programs. These direct allocation federal programs are in addition to the vaccination initiatives already underway by states and local jurisdictions. And in this work, we seek to model best practices regarding data collection and collaboration, across these federally supported programs, and to also elevate state and local settings where this work is already being done well. This is why the exchange of promising practices, part of today's forum, is just key. Sharing what works on the ground, those innovations, those practical approaches, those strategic partnerships. Those are all a must to overcome the structural barriers that still exist for too many. And doing this work well requires coordination at all levels, including federal, state, tribal, local, and territorial governments, healthcare providers, businesses, community-based organizations, unions, others. Doing this work well also requires high-quality data to guide and target our efforts. We know the COVID-19 pandemic continues to cause disproportionate harm to minoritized and marginalized groups, communities of color and rural communities, people with disabilities, older neighbors, those who are justice involved, and others. And early data suggests many of the hardest hit groups are not yet getting their fair share of vaccinations. For instance, even though we only have race ethnicity data on a little more than half of all vaccinations in the country, a clear pattern has already emerged. People of color are getting vaccinated at rates below their representation in the general population. This narrative can be changed, it must be changed. And many state, as well as these federal initiatives, are working to disrupt this pattern and ensure equity. We know these challenges reflect longstanding, deeply rooted systemic realities. And so we're not suggesting that these problems are easily solved. And we must attend to the underlying social and structural drivers as we look ahead to building resilience into our recovery. What we do believe, though, is that the way we get America vaccinated and the emphasis we place on reaching the hardest hit communities, that's just as important as hitting the goals for the number of people vaccinated. The Biden-Harris administration is committed to a multi-pronged vaccination strategy that is fair, that is equitable, and efficient. So in closing, I want to acknowledge and salute the teams at CDC, at FEMA, and across the federal government for their extraordinary leadership and early success operationalizing the national strategy for the COVID-19 response. And let me extend my thanks to each of you for all you're doing to keep yourself, your families, and all our communities safe. Please be well.
Good morning. It is a pleasure to be with you this morning, and I want to thank our colleagues at the CDC for inviting me, as well as the other FEMA officials that you've heard from. It's an absolute pleasure to be here during this important forum, and I hope the information you've heard thus far has been useful. I want to thank Rear Admiral Collins for the introduction. My name is Jolinda Johnson, and I want to tell you a bit about the work that is being done at FEMA in conjunction with our partners at the CDC, at HHS, and others to ensure equity in vaccine distribution. First, let me start with FEMA's commitment to equity. FEMA is committed to ensuring the impartial and equitable delivery of programs and services during vaccination efforts. We are required to do this by the Stafford Act, and this has also been outlined in several executive orders by the Biden administration on ensuring an equitable and data-driven response to the COVID-19 pandemic. FEMA is actively engaged in the analysis of demographic data to provide leadership the best possible advice to ensure that underserved and historically marginalized communities are not left behind and that anyone who wants a vaccine can get one. I would like to tell you a little bit about our site selection process. I know that many of you have seen on the news the opening of several FEMA sites across the country. I'm joining you today from New York and Medgar Evers College in particular, where we are opening a site today. It's a very exciting day for the state of New York, and FEMA is proud to have partnered with the state to serve the citizens in this state. When we make site selections like this one, first, through a data analytics team at FEMA, we take a look at both population information as well as what the CDC calls a social vulnerability index. The social vulnerability index has roughly 15 indicators that contribute to identifying whether a community is underserved from a health equity standpoint, as well as many others. Together, population data and SVI help to inform FEMA in its site selection. That has informed our site selections in California. It helps to inform our site selections here in New York. In addition, FEMA engages with the states wherein we're operating to understand their plans and resources and ensure equitable supplementation by FEMA to the state's already robust efforts. States are in the best position to understand their resources, both healthcare providers as well as community resources. And FEMA relies on this understanding and perspective to validate and layer its data analysis and determine the appropriate location for a FEMA conducted site. In addition, FEMA is collaborating with the Census Bureau to utilize their Community Resilience Estimator and American Community Survey to further FEMA site selection efforts once we have identified the appropriate location based on SVI and population. So it's a combination of very powerful tools and indicators together with on-the-ground information supplied by the states and by community-based organizations that help to make site selections. I also want to talk to you a little bit about our equity analysis. So often FEMA gets asked the question, how are we ensuring equity in vaccine distribution? And this really is the most important question. How do we make sure that those underserved communities, those historically marginalized communities, those communities most impacted by COVID-19, how do we make sure that those communities are reached and are vaccinated? We have done several things. First, we at FEMA have stood up a civil rights advisory group, and that advisory group includes many different offices within FEMA, as well as partners across federal government. We are pleased to be joined by CDC personnel, by HHS Office of Civil Rights personnel, by other offices within HHS, including ACL and ASPR or ASPR. We're thrilled to have all of them contribute. We are also joined by the Department of Justice, the Civil Rights Division, as well as the Department of Homeland Security's Civil Rights and Civil Liberties Office. Together, we can solve some of the equitable challenges that we're faced with. And there are challenges every day, but we are working very hard to address them. One of the ways we do that on the ground is that FEMA has deployed civil rights advisors to all 10 regions, 10 FEMA regions that is, to ensure that on the ground information can be supplied, and those individuals, those advisors are there to support the regional administrators across FEMA in working with our states, tribes, and territories. In addition to the civil rights advisors that have been deployed, we also have regional disability integration specialists to ensure that disability considerations are integrated into all plans as we roll out vaccination efforts. FEMA has also issued a couple of important documents to assist our states, tribes, and territories in ensuring civil rights considerations are built into their plans. The first is a civil rights checklist. This checklist asks states to go through and identify and correct any problematic issues to ensure equal access, accessibility, both from a language perspective, a communication perspective, and a physical access perspective to the entire community. We have also issued a demographic advisory. And this advisory makes clear to states the requirements to collect demographic data at administration of the vaccine so that we can actually validate that we are reaching the communities that we intend to target with our community vaccination centers or CVCs. These two documents, together with several other wonderful tools that have been provided by the CDC, by ASPR, and others, all live on FEMA.gov. FEMA.gov has a vaccine support page, and on the vaccine support page, there is an equity section, which reflects our commitment to ensuring equity in all that we do when it comes to vaccine support, all that we do for states, tribes, and territories, as well as those sites that FEMA sets up as well. With that information on hand, FEMA is reviewing overall state demographics and layering that information with what we know about the individuals who have received a vaccine to monitor whether or not the communities that we seek to target, those underserved communities, are actually accessing the vaccine and being administered the vaccine. I heard Rear Admiral Collins specifically speak to the need to get shots in arms. And I want to echo that. That is paramount to the efforts of all of the agencies that are working so hard in this to respond to COVID-19. I mentioned that we have stood up the Civil Rights Advisory Group. I've talked about our site selection process. I hope that answers some of the questions. I'm sure there are others with regard to equity. I know that Dr. Nunez-Smith also talked about equity, and FEMA, of course, works hand in hand with the Equity Task Force at the White House. We appreciate all input. We are working to connect with community-based organizations, faith-based organizations, as well as the larger states, tribes, and territories in making sure that communities across the country, big and small, have access to the vaccine and actually receive the vaccine. In closing, I just again want to thank the CDC for their partnership and their collaboration and their willingness to support and engage with us. Everyone at FEMA greatly appreciates and relies on the brilliance of all the scientists and doctors at the CDC, and we appreciate the continued partnership. FEMA welcomes all perspectives and feedback for its efforts and actively encourages individuals and community-based organizations to provide us that feedback. I do want to put in a plug for a disability stakeholder call that is happening this afternoon so that we can ensure that concerns by the disability community that are not being met on the ground can be heard nationally so that we can share that information back to our field level personnel. FEMA knows that it can only succeed with the knowledge and help of our federal partners, and we are committed to also being a good partner. Thank you again for the opportunity to provide remarks, and I look forward to a continued wonderful collaboration. Thank you.
Good morning, and thank you all for joining us today and for the past 2 days to hear success stories and engage in thoughtful dialogue. Doctors Nunez-Smith and Johnson were incredibly eloquent in detailing the problems we face and the opportunities we have as a nation as we work together to ensure fair and equitable COVID-19 vaccine distribution and administration. For me, this year has also been an incredible opportunity to listen and to learn from people like Dr. Nunez-Smith, Dr. Johnson, and Rear Admiral Collins, and the rest of the panelists that we'll hear from today. On Monday, CDC's director, Dr. Walensky, said an important element of the vaccine rollout is the extra care for the most vulnerable in our population. Today is all about how we work together to do just that. There has been tremendous progress in vaccine development this year. We know a great challenge lies ahead of us as we engage and educate communities to get ready to be vaccinated. CDC's pandemic response and vaccine campaign is built upon science, transparency, and equity. These themes were illustrated with local application through the forum and today's sessions. CDC is committed to ensuring equity in vaccine distribution and administration. Efficient and equitable access to COVID-19 vaccine requires a coordinated effort across multiple partners and sectors, including federal, state, local, territorial, and tribal governments, healthcare providers, businesses, community-based organizations, and unions, and many others. It's essential that as we roll out each vaccine and the overall vaccine program, the people who must have access to vaccine can trust that it's safe and effective. And we know having vaccine available doesn't matter if people are unwilling to get vaccinated. Our goal is to ensure that everyone in every community everywhere have access to vaccines, as well as have trust in the vaccine, the vaccinator, and the system that produced it. CDC is working with communities nationwide to rebuild trust, especially in communities of color that have been disproportionately affected by COVID-19 and have experienced systemic racism and inequity in access to healthcare. We've made progress, but we still have a long way to go. And we know that we have to work together to ensure everyone has access. Just like viruses don't discriminate based on race, age, or sex, those qualities should not keep anyone from the protection a COVID-19 vaccine offers. There are thousands of success stories happening across the country every day, and there are many lessons to be learned from the challenges faced ensuring equitable vaccine access. During this National Forum on COVID-19 vaccine, we've been able to shed light on some of them. Over 13,000 registered participants from over 6,700 different professional organizations through the forum have access to practical suggestions and critical information on how to implement vaccination effectively, safely, and equitably. We've heard about work to increase vaccination being done at all levels of government, across non-governmental organizations, and even at the individual level. And we've seen examples of successful public-private partnerships. We've seen solutions and innovation emerge from efforts shaped by unique local circumstances. Some of the greatest lessons learned remind us vaccination strategies need to be centered on equity. Trusted voices are critical to building confidence in vaccines and addressing misinformation, and often come from community leaders. Data guides our way, helping us to develop our plans and change our plans if an approach is not working, and enabling us to hold ourselves accountable for getting vaccines in people's arms quickly, safely, and equitably in every community. Leveraging existing infrastructures and innovative partnerships optimize access and reduce barriers to vaccine for people at increased risk for COVID-19. Engaging communities and diverse established partnerships, including longstanding community-based organizations, are essential. Strengthening relationships among public health, public safety, and healthcare systems accelerates equitable vaccine administration and saves lives. Today, we'll hear from leaders of community-based organizations, federally qualified health centers, local and state health departments, and many other partners critical to getting vaccines in arms across the United States. They will share their approaches and strategic efforts to increase vaccine access in all populations, especially those at increased risk for COVID-19 disease and those who face systemic barriers to vaccination. I look forward to hearing what has worked and figuring out how we can scale up these strategies to make sure every person in every community has the opportunity to be vaccinated. Vaccination is a critical tool in bringing this unprecedented pandemic to an end. Reaching every individual who would benefit from vaccination is an important and ambitious goal. This is going to be incredibly hard work, but it's a goal that we can achieve by working together.